I think that one of the practices that I have employed is making sure that we amplify the patient's voice, making sure that they're allowed to give their patient story, validating their experience. And then also, sometimes it works when you share your own personal reflection and talk about your own family. Or, I have many people in my family who are hesitant to get vaccinated. And what I try to do is support them, provide them with the information. And again, this is a conversation that has to be on repeat. It may not be solved in one, again, I've gotten most of my family vaccinated, but again, I understand that it's a conversation that has to reoccur. And I think as we think about community strategies, we have to also engage community partnerships, community leaders. We have to look at faith-based organizations, but I think also we can lead by the example and letting them know that we have gotten vaccinated. And so these are some of the strategies that I have tried to employ. Dr. Gyamfi or Dr. Waldorf, do you want to add to that?
Yeah, I mean, I would second what you're saying. I think it's very important not only to validate the patient's concerns, but also to speak to what's happening in our own families. Because for most of us, it's a conversation with everyone, just letting them know, what the data show and what we've done, and getting vaccinated myself and my husband, and then as soon as my kids were eligible, they got vaccinated. So those are our stories, and I think that when you listen with your heart and you put a face to this pandemic, then it's not only advice, it's what you're doing in your own family. I think that makes a big difference.